As we age, sometimes it's necessary to get in-home care, but you might be wondering, how much does something like that cost, and what are you going to pay for it? Well, Dr. Albert Munanga, CEO of Serengeti Care, is now back with me to talk about home care services and how to make them affordable. Thank you for being here.
Thank you for having me back.
Before we get started with the nuts and bolts of finance, tell us what Serengeti Care does.
Well, Serengeti Care, we specialize in delivering care in the comfort and privacy of our clients' own homes. So we hire and screen caregivers and healthcare professionals to go and deliver care at our clients' homes.
Which is important because people don't want to leave their homes if they don't have to, right?
Nobody wants to leave their own home if they don't have to. You know, there's nothing that beats the dignity and the peculiar safety and comforts of being in your own home.
Yeah. So there are several ways, I understand, for those who are seeking in-home care can actually pay for it.
Yes, indeed. There are several ways you can pay in-home care. The main ones are, number one, is from your private funds, your savings. And those could come from family contributions as well. Sometimes families come together for their loved ones and put their resources together to be able to pay for their loved ones' care. So private funds from your savings is number one. Number two is a long-term care policy. Some people at some point may have bought a long-term care policy that includes in-home care that may cover for care. And every policy is different. And there are, you know, there's a criteria for that. But that's one common option. Number three is actually, for those that qualify, is Medicaid funding. In the state of
Medicaid can also help.
Medicaid can also help. We serve many Medicaid clients here at Serengeti Care. So Medicaid is another way you can pay for your care. The other one, which is a big one, is also the VA for even so for some family members, like a spouse or a veteran. And we're proud. We serve those that have served this country all over the region in Oregon, Washington, and Idaho.
That's amazing.
So the VA is another one. And then there are some pensions. You know, different pensions offer some in-home care. Now, many people may not actually know, so all you have to do is ask those questions.
Yeah, that was going to be my next question, because if somebody's out there watching and has been thinking about getting in-home care, or somebody is thinking about doing it for a loved one, where do they go? How do they get started?
Well, give us a call at Serengeti Care. We have dedicated client care managers who essentially are case managers that understand the difficulties and the complexities of navigating the healthcare landscape. They will sit down with you, ask those questions, and help guide you in the right path.
That's really helpful, because I think it's whenever we go into anything that we're not sure about, it can be really intimidating, and it can be really like, what's happening? So if somebody was sitting down with me, that would make all the difference, and really going through all the issues. So what if someone still has questions right now and they're watching? What should they do?
Well, again, ask. We are here for you at no cost. So you can call for a free consultation and speak to one of our client care managers, including billing specialists, those that understand the billing issues. You know, they'll work through any questions you might have.
All right. Before I let you go, any other words of advice for someone who might be going through this or watching a loved one think about coming to terms with getting in-home care?
Well, I think the biggest advice I can give is to plan ahead.
Plan ahead.
Even if you don't think you need care now, it's good to start the conversation going, and we're happy to be a resource to our community. So give us a call, and we can walk through and give you those options so that you can have a roadmap when the time comes.
That is a great service. Thank you so much. It's so good to see you again.
Well, thank you for having me.
Absolutely. And of course, if you would like to learn more about the services Serengeti Care has to offer, just visit that website you see on your screen.
This portion of New Day Northwest is sponsored by Serengeti Home Care.